rendus d'échographie.
These are all of my ultrasound reports. I kept everything. It's the only evidence that my babies ever existed.
Their names were Maya, Alice, and Raphael. Julie's babies all died, each before her pregnancy came to term. Every year, thousands of families lose their children in utero. It's an issue that's difficult to address in France.
Since everybody behaves like it hasn't happened, I can't speak up. That's the denial of perinatal bereavement. It's also very difficult to talk about the death of babies and children in general. There is no word in the French language to describe a parent who loses their baby or child.
In France, perinatal mortality is defined as the death of a baby between the 22nd week of amenorrhea, generally 2 weeks before fertilization, and the 7th day of birth. It includes death in utero, medical termination, or early neonatal death. It affects more than 1 in 100 pregnancies.
Yesterday was the anniversary of the due date of my first baby, Maya. I posted an update to remember her.
Julie created an Instagram account to break the silence around the issue and share advice.
Well-intentioned messages can be painful when people don't understand. I give very practical advice, such as avoiding clumsy, cliched phrases like "you'll have others" or "it wasn't a real baby yet."
The International Pregnancy and Infant Loss Remembrance Day is observed on October 15th, symbolized with this blue and pink ribbon. The organization Agapo was created in 1994 to support people who are dealing with perinatal loss. It also gives maternity staff advice on how to better deal with these tragedies.
Health workers are in great need of support. They need time to decompress. They aren't the ones losing a child, but being confronted with suffering is hard, and they don't have much chance to offload.
The organization helped this hospital in the northwest of Paris to create a space for parents and maternity workers to gather. It aims to give visibility to the reality of perinatal mourning.
At least they know it exists, and if we talk to them, it might encourage them to be more open about it.
Recognition of grief is a first step. Another is to officially recognize the existence of deceased babies. In December last year, the French government adopted a law that allows parents of stillborn babies to name and register them. This psychologist says parents must be able to integrate such an event into their lives.
Society tends to tell people to move on, so many parents stay quiet about it. These are traumatic events. They're very hard to heal from.
In 2019, of nearly 750,000 deliveries, some 6,400 children were stillborn. A report by the Public Health Agency shows that France is failing to reduce infant deaths. Neonatal mortality has risen by 25% in 10 years. Overseas territories are the worst affected. For every 1,000 newborns, more than 4 die in the first month. That's twice as many as in mainland France. But could some of these tragedies be avoided? The Public Health Agency has called for better access to health care. It says the general state of health of mothers has declined. More women are in precarious situations or even homeless when they give birth. In the Greater Paris region alone, the number of homeless mothers has quadrupled in the past decade. There are other factors that could contribute to the rise in neonatal mortality, such as age and weight.
A quarter of women who give birth are over 35 years old. Body mass index of mothers is also on the rise. And when you combine the two, it really increases risks during pregnancy and childbirth.
Alcohol and tobacco consumption also remain a factor. In France, 16% of women admit to smoking during their pregnancy, one of the highest rates in Europe. Pediatric wards are witnessing unprecedented staff shortages, says Professor Jean-Christophe Rosé from Nantes University Hospital. Since COVID-19, the situation has gotten worse.
Young doctors are less and less willing to do night shifts.
and they're avoiding specialities with on-call duty. We'll have to adapt. Many people prefer to give birth close to home because they think it's safer. But we no longer have the human or logistical resources. The authorities really need to step in to take control of the situation.
In France, legislation governing the operation of maternity units has not changed since 1998. Doctors say it needs to be updated urgently to improve the quality of maternal care.